Another story that we're going to be bringing to you today has to do with government's efforts to try and increase access to health care. We're being told that the Phelophepha train, that's a healthcare train, will be making a stop in Springs today. And this is part of the health department's efforts to try and ensure that communities, sometimes in far-flung areas of the country, have access to healthcare workers, or healthcare services rather. And this is also just outside of the COVID-19 pandemic itself. This particular train is in partnership with Transnet. So let's give you more details on the objective here and what the plan exactly is. Sipha, Kema, watching these developments very closely for us. So Sipha, there is a context in which this train is operating, widespread concerns around how even the healthcare system is able to operate. Paint that picture for us as a start before we try and locate the importance of this type of train.
Well, of course, Ayanda, we know that prior to the pandemic, the healthcare system in the country, of course, was not doing too well, especially in the rural areas. So this particular train, that's how it actually assisted these communities going to far areas, as you've mentioned. Now, taking a look at how, of course, the pandemic has affected the healthcare system. I mean, we've seen a diversion of the healthcare workforce being redirected to fight COVID-19. We've seen that, of course, people who were meant to go out for treatments have not been going out for treatments as well, not only because of distance, but also because some had said that they were being turned back away from the clinics, of course, and then also looking at what is most needed during this time, Ayanda, psychological assistance. Now, the train, part of the clinics in the train, a psychological clinic is available, which will help assist those, of course, who have dealt with a huge blow during the pandemic. I mean, people have lost their jobs, people haven't been getting income. So we know that, South Africans in your rural areas, in your townships, don't have access to, healthcare such as psychological, especially your primary healthcare, which is your dental, your eye care, and as I've mentioned, psychological healthcare, but also looking at pharmacy. I mean, medication has been on the low as well, and also screenings of your HIV, AIDS, and diabetes as well.
So how exactly does this train work, Sipha? I mean, are patients meant to go to the train station where this train supposedly will stop, and how is that different to them going to a clinic in the area, for argument's sake?
Now, this train has been around for years, Ayanda, and a lot of South Africans have come to know this train and are familiar with the services, this train has to offer. Now, it focuses mostly on your rural areas. For example, it was just in KZN in May, and the districts and the areas and the regions that it focused more, especially during COVID-19, were mostly, the disadvantaged areas, your rural villages, where people are not able to actually get to the clinics, and they're far out and they have to walk, and there's not enough transport available. So this clinic makes sure that it actually docks in nearby villages where people can then come to the train. I mean, it spends a couple of days, maybe 2 days in a certain small town, in a small village, where people then can go line up and get the proper healthcare evaluation from your eyes to, of course, as I mentioned, getting your, pills if you need them, and, psychological evaluation if that's what you need, dental health care. I mean, dental health care to some, it's not just primary health care to some people. For some people, it's something big, they don't usually go for dental health care. So this train offers that, and most especially during this time, it is going to assist and kind of alleviate the pressure from the healthcare system.
Yeah. I can't imagine a situation where I have to wait for a train before I can get some of the most basic help insofar as my health is concerned. So the sentiment is meant to be a feel-good story, but it's also quite an indictment that we even need a train like this to get to certain communities. I
mean, it asks the questions which we're going to ask today, is that this train has been operating in the rural villages, in your townships, for a very long time. 4 years. I mean, now with COVID-19, we know that COVID-19 actually showed and highlighted the challenges that are faced by the healthcare system, where that's when resources now were starting to get gathered in so that they could assist the healthcare system. But now with this train said, yes, of course, it's all good that it's assisting the communities. It's all good that it's, in partnership with the health department to assist the country. But it also asks the question that our healthcare system, when is it finally going out into the rural areas, into the township? When will people receive adequate primary health care that they will be able to sustain them, basically?
100%. Those are certainly important questions. Sipha, Kema, thanks very much for coming through, helping us locate the importance of the story as we usher in this Wednesday. Certainly worth your attention as we try to figure out how exactly these type of interventions are going to assist not only in the fight against COVID-19, but generally in our efforts to try and increase access to healthcare systems in the country. Sipha, Kema, making a very good point that was well made even at the start of this pandemic about how it's showing us up for some of our shortcomings, at least insofar as public health is concerned.